Thank you very much, Bill. We've about 20 minutes now for questions and answers, so I'm going to start with Niall and give Bill a little bit of a rest after all that. Okay, Niall, first question. My child is in primary school. There is a new post-primary school planned in my town to be completed in the next few years. There doesn't seem to be a plan for an autism unit, even though there is a primary school in the town with a unit. What steps can I take to make sure children with autism will be accommodated in the new school? Thank you.
I suppose my sense there would be just the first thing to talk to the primary school, because there is much more liaison between primary and secondary school now than there was before. And if you still got 2 or 3 years in place, then this is the time to do it. Link in with them, and also link in with schools around to see if there's other autistic children who may end up going to that secondary school, not just from that individual primary school.
Okay, this isn't going to
so I suppose it's just that sense of start now. I think you've highlighted, you've seen it early enough to make sure that is the case. And then find out what else needs to be done from there as regards to the Department of Education, what sort of conditions they would put on it. But my sense is, if you have a unit there, it should make sense to be moving those same children into the same locality where possible.
Thank you. Bill, your turn now. Do you offer services to special schools and early intervention settings?
Personally, I don't, because I'm kind of working full time at the moment. But you know, I would have colleagues that work in private practice and would be available for working in special schools and for private practice, and in the home as well. They do a lot of work in the home. One way to get in, I know funding is often an issue. The way I got into Child Vision and into John O'God was through VEC hours. So that's the way you can access maybe services that way. So just to bear that in mind, it's very helpful. Yeah.
Now, with the new accommodation scheme being introduced for Junior Cert and Leaving Cert, will the recommendation for accommodations of Junior Cert still rest with the school, or will that pass to the State Examination Commissioner?
No, it's going to rest with the school still, but I think the State Examination Commission are doing an upskilling or a new training rotation now the next 12 or probably 6 months, I suppose, at this stage, and the current applications I think are due to finish December or January, so applications need to go in for as soon as possible. But my sense is it stays with the school, but they'll have a closer liaison with the State Examination Commission as regards upskilling the teachers and making sure everybody's clear as to what's needed and what needs to be followed through on that regard. And I think NEPs are training up as well on that. The other thing we recommended, and I think they're going to do, is that they have to evaluate, because they weren't able to tell us how many children had got in Junior Cert and didn't get it in Leaving Cert, and similarly how many had gone through. So they need to assess how this is working as well, and that will be much easier when they've all come through the same system. So that the school will be able to tell us how many children they actually got in Junior Cert, and then we assume there's the same number in Leaving Cert. So unless anything changes dramatically between Junior Cert and Leaving Cert, the same children will get it. And that could happen. Something could happen to a child, an acquired brain injury between Junior Cert and Leaving Cert. So there still will be slight changes, but most of the time that'll be all through the schools.
My child is 6 and has been diagnosed this year with ASD. He has very sensitive hands but loves music. I feel I'm avoiding him partaking in playing an instrument for this reason.
Okay. I suppose sensitivity around touch I've worked with children with that before. I suppose receptively you can work with children without it being active at the start, and maybe just introducing them to singing, and I mean using the voice I think would be the way in there. Maybe introducing a song that maybe should have an instrument like a shaker, but maybe the parent doing it first, you know, and perhaps the child would become more relaxed around that. Then maybe there's also instruments like wind chimes are a beautiful instrument. They're about €50. They're on a stand, and they only require a tiny touch, like the smallest touch, but creating sound that way. So.
Okay. Now, my son is in the mainstream school. Our staff of school is going to get more training in all disabilities. Thank you, Fiona.
I'm not 100% sure. I mean, we certainly would be working in that direction. That most the move to mainstreaming has probably caught a lot of mainstream teachers off guard, and I do think there's a need to upskill a lot of the teachers in that regard. And I do think there's more and more teacher training days in regard to that, but I don't know if it's been rolled out as a national thing, or is it left up to the principals to decide this is the way I need to go as the principal. So it's certainly something that I would be encouraging for the Department of Education to roll that out as much as possible. And I think I've also linked in with a number of the teacher training colleges as well to make sure that they give some sort of input in that regard. So it's not guaranteed that it'll be rolled out to every school, but I think a lot of the principals are very much acutely aware of the need for it.
What age is a good age to start? Are headphones required? Can a child participate in activities while doing it? Can this happen with a group of children in one session, or does it have to be one-to-one? What type of music do you start off with to train the inner ear? There's a lot of questions in that one. You can pick one if you want.
Maybe just call out the first part again.
What age is a good age to start, and are headphones required?
Any age is a good age to start. When a baby is born is a good age to start using the voice, singing while you're doing an activity or while you're doing an ADL. So I think introducing music could start there. Either with groups or individuals can be beneficial for either. I suppose I generally would kind of be moving people towards a group if I could, but sometimes children require individual input. But then the groups would be more in and around the social skills area and interacting with peers. So sometimes it might be appropriate to work individually with a child and then maybe pair up the child with another child and then move into a group setting. And
the last bit then was what type of music
earphones.
do you start off with to train the inner ear, and do you need earphones?
You don't need headphones.
Okay.
If the sound equipment is good. I would say a range of music. I know in one of the classes in the school, the teacher is very into bebop and jazz, and those kids are loving Charlie Parker. So anything from trad, I think a variety. Actually, the songs I've used for the signifiers for the days of the week are all from different genres. So one is Cuban, one is Irish, one, they're from different countries and different. So I think a variety of music is probably the best approach. Yeah.
Okay, you're going to have to bear with me on the next one, Niall, because there's a lot in the question, and
okay.
the reason I'm sticking with it and not taking another one is because it seems to be an important issue. What would it take to get the OCIO recommendations awarded when a person makes official complaint regarding their child's lack of access to special education supports, school places, after writing through the HSE, your service, your say to the school's board of management complaints process, and now facing no suitable education placement at secondary level, a very frustrated parent?
Okay, so in situation, I mean, no child should be left without an education placement. So it's certainly something. If all the local resolutions have been tried, then certainly come to my office and we'll see what we can do about it. It's that shouldn't be the case. I suppose it's without exact details. It'll be hard to.
Like that's the OCIO.
Yeah.
Oh, you've been to the OCIO, is that?
Yeah.
And okay, and we have recommendations.
Well, no, because it coincided with both health and education, which is the barrier I've faced for 6 years, where I had to go through two simultaneous complaints procedures, one with the HSE and one with the school and the board of management. Now I've completed the board of management one. I haven't completed the HSE one.
Okay, and are we
and
engaged?
you replied to go through the local.
Okay. So are we at that stage? Well, maybe I can chat to you. Is it fair to say I can chat to you separately?
Well, now that we're at secondary with no appropriate setting, I'm going.
Is the child in school?
He's in school, but under immense mental health issues and all the services.
Maybe if you could link
Okay.
up afterwards.
I certainly,
that
I'll be
might
quite happy to. I'm quite happy to chat to you individually. Yeah, if I can.
I'm
Yeah,
very
absolutely.
important.
Of course,
Thank you.
of course. Yeah.
Okay, Bill, how do you work with a child with sensory processing issues, particularly with severe noise sensitivity?
Okay. I suppose from my own point of view, it would be trial and error, starting out very gently with different sounds and introducing sound very carefully with silence also. working sometimes with children with sound sensitivity, what I find is that if they don't have control over the sound, they're very sensitive to it, but if they have control over the sound, they're less likely. So it could be, I suppose, I've worked with children maybe just placing instruments near to them but not putting them under pressure to play, but maybe playing softly myself but providing them with maybe a stick for a drum and encouraging them that way. And then with I suppose sensory difficulties, I suppose using instruments that provide different forms of sensory feedback. You know, even some children really enjoy the feeling of strumming the strings on a guitar as opposed to maybe hitting a drum with the hand and that.
Okay. Niall, a child with multiple disabilities that are invisible, that appears to manage to get through a day of secondary school, but at the cost of their mental health. Teachers expect more of the child. The child is not able to concentrate. It's a kinesthetic learner, Asperger's. How are they supposed to get their basic education within mainstream? They're the big questions today.
Yeah, I mean, I think it's difficult within mainstream. I think this is the sort of move we have to start making on a systemic level. We have to allow for the individual needs of children. I think that's something we haven't quite got to yet. I think I have lots of examples of schools where they would deal with that very well because people are clued in and they make that flexibility. I think it's something that needs to be facilitated through the individual school, and principal needs to link in with whatever resources are needed. But again, it's that idea that the Department of Education need to support something slightly different that isn't in the box ticking scenario. So they're not looking for someone with a specific diagnosis. They're not looking to say this doesn't fit because it doesn't fit this system. It is at the moment it's about finding the individual, identifying the needs, and then finding the school to fight for the resources that allow that young person to get the maximum out of their education.
Sorry, that's my question. My daughter actually has all the resources she could possibly get.
Okay.
But like she hasn't gone to school since Tuesday because she cannot cope going in. She's 12. She's just gotten over anorexia. She's very aware of the differences. Everybody else is on their sixth question. She's only on their first question to know. So in terms of school fighting for everything, there's not really much more they can fight for from the Department of Education. But I'm wondering, is mainstream the best? Is to know where
the alternatives then, I mean, I suppose there are limited alternatives from the mainstream. I mean, the other option is sort of education welfare officer giving you some sort of guidance as to how you can do home tuition in that regard, but that's obviously a step you need to look at. That mainstream, I'm not quite sure what the alternatives would be in that circumstance, because I think we do try to force everybody back into mainstream until they're 16, and then there are early school leaver options. There are that option, but 12 is quite young for that situation too. But it's, and again, I'm trying to think there possibly are options that I'm not aware of, but I can certainly try and find some things that you want to talk about.
Sorry, I'm the homeschool community liaison in the secondary school, so we might have a few solutions, so I'll actually have a chat.
Yeah, I think I'm certainly in situations like that. I've seen many schools where they've allowed a child to take what they need, time off, and still make sure that they come back, and it could be an individual teacher going out to them. It could be all sorts of connections. Maybe they come in just for the sports or whatever they like, art or whatever it might be. But I think schools are more and more flexible in that regard. It's not as we saw in the coach and the children, it's not the be all and end all to get the academic. And I think teachers and principals are recognising that more often. So if she loses a year now but comes back happy and confident, it's worth it for everybody. So certainly I think if you can find the liaison, that'll be great.
Okay. So the link there maybe. Okay, thank you. Bill, I've heard that music therapy helps children with dyslexia. Does it help, and how does it help if it does?
I'll be honest, I'm not very up to date with music therapy and dyslexia. With learning and with reading and learning, I know music therapy is used a lot with phonics and that. To be honest, I'm not 100% sure how it's used specifically with dyslexia. Yeah.
I was at a lecture a couple of weeks ago on the Society of Ireland Aspire, and there was a lady called Dr. Nisha O'Reilly,
confidence.ie for people, confidenceclub.ie for people who didn't hear that. I think actually the question and answers is really reflecting the richness of the knowledge in the room as well, which, as I said, we do have an hour's lunch break back out around the stands in a minute, and it's really important, I suppose, that you try and network, because there's so many answers for so many people within the room as well as our expert panel. But we'll maybe just have one more question for each of the speakers before we break for that. Now, the last question for you, would the Department of Education consider home tuition, early intervention for children from 3 years of age with disabilities other than autism? Other disabilities need a similar level of support, whether it's behavioural, speech and language, occupational therapy. The HSE EIT does not provide this. SNA support is not the same as early intervention.
Is the essence of that the home tuition
Yes,
before the normal time of home tuition? Again, that's something I wouldn't have been aware of now if anybody looking for home tuition in an early stage since the new preschool year has come in. I think the plan is that everything, again, it's done within the systemic side of things. I'm not sure there's any plan for for home tuition preschool, because again, even the early school there was a discussion as to who's going to be in charge of the early school or the preschool situation. I think it's joint between Department of Education and Department of Children. So it's not something I'm aware of at the moment, but I think they certainly should provide as much opportunity as possible for young people to go into the preschool. There should be as much support as possible for that. And it shouldn't matter it's not about the diagnosis. It's certainly needs led, so it's whatever the child needs. They should be able to get the support that allows them to access the same as any child without a disability would get. That's what you're entitled to now with the new AIMS project, as far as I'm aware of.
Okay, and last one for Bill. How to get training to staff and to get them to understand why. So I think this is about how in the schools we can get teachers to work with us on these matters. From
a musical point of view, yeah. I suppose it's challenging. I suppose if a school has a music culture of some sort, or a music therapist, it's easier. I've had faced huge challenges in schools in I suppose the way music therapy is seen and the way it's seen that the child needs to be active all the time, and as I joked earlier, take your turn now, and not seeing it as a communication, I think I suppose schools often can't afford a music therapist, and maybe schools don't have a full-time music teacher. I think that the way I work in school, kind of consulting with teachers and staff and providing resources and looking at their day and how music can be built into the day, I would see the best way forward for music therapy in a lot of schools would be that the music therapist comes in for a week and works with the school, does training with staff around that. I think that's probably the most cost-effective way where schools maybe can't afford to have a therapist in.
Okay, yeah. Thank you. Can I just thank both speakers for their generosity in taking questions? Lots of speakers don't. We accept it. We just expect it from our speakers. But I go to lots of conferences, and this isn't the norm all the time. But both at our National Education Conference and this conference as well every year, we just expect our speakers to take questions. So thank you very much to both.